get what you pay for.
There's more complex dementia pictures that are just hard for a person, even with medical experience, to manage on their own. There's less complex situations where I think anyone would prefer to pass away in a familiar place with, surrounded by family. There's a comfort to that. Yeah, I spent some time working at the VA. That's a great program. You get a lot of work with patients with trauma and more complex kind of presentations. I'd say just as a general statement, it's kind of a misnomer that people with schizophrenia are more dangerous than the general public. There's a certain period where they are more dangerous, but it's usually early on in the illness process when they realize they have schizophrenia, and it's usually regarding self-harm. Because schizophrenia, most physicians are reluctant to provide as a diagnosis because it means this is a lifelong, unrelenting, kind of always deteriorating illness that we really don't have a quote treatment for. So there's a period of time where patients are understand that fact and are still suffering with a lot of the symptoms, and at that point they're much higher likelihood of self-harm. When it comes to kind of especially paranoid schizophrenia, you usually have a multivariable presentation where there's a family history, where they're strong or weak, and then there's an inciting event. For men, it's usually between the ages of 18 and 22. For women, between the ages of 22 and 28, whether it's kind of going off to war, a trauma in general, sometimes childbirth, or kind of the early postpartum depression can actually be one of the kind of acute psychotic events. Usually there's multiple variables, and then there's a kind of a pushing kind of a point of no return of inflection. Well, certainly a certain number of illnesses, actually schizophrenia being one that's been kind of passed down genetically. If you can reproduce before these illnesses can emerge, they don't get kind of cleaved by evolutionary dynamics. An interesting thing regarding dementia, as an aside, a great study just came out 9 days ago that showed that vitamin D exposure, or using 1,000 units of vitamin D daily, starting at the age of 55, had a 45% decrease in Alzheimer incidence. So between the end of September and the end of March, the sun's actually moving away from the Earth. So the amount of vitamin D that we're getting this high in our hemisphere, genetically, we spent 99% of our time at the equator. It's just recently we've migrated this far north. We're really not supposed to be here as human beings. So I use it. I use it every morning. It's 15 minutes a day on a 4-inch by 4-inch patch of skin. You have to be at least 2 feet or closer to it. It's a big aluminum box. The problem is the D3 is fat soluble, so it needs to be conjugated in your stomach, and then it's absorbed in your ileus, which is the second kind of portion of your small intestine. And because it's so complex, absorption rates can vary from about 5 to 60%. Whereas with a light therapy lamp, it takes about a week and a half to get to normal vitamin D levels. It can take as long as 6 months if you take it by mouth. I was to say, the longer this is a hard thing to do, sit and talk for this long. I couldn't do this volume of kind of conversation one way. So I imagine whatever the truth is about who you are, or your tendencies, your personality, eventually comes out just with how long you have to be communicating. The amount of effort it would take to create a character that was consistently off the cuff and kind of reactive would be, I think, close to impossible. Maybe for a skit or for like a set that you're practicing over and over, but he's improving, or anyone here is improving, for hours at a time. That's hard to keep a character going like that. Well, Ernest Becker, a really great psychiatrist from the 70s, wrote this great book called The Denial of Death, that says that the thing that makes us not animals is simply that we know that death exists, and it may be, all of us really only just fear death, and the rest of this is a construct to distract us from that fact. And none of us would choose to die early if we had the chance to live longer. Yeah, it's an interesting theory that the only thing that makes a human different from an animal is that one bit of knowledge that death exists, and the rest of this is like bloomed out of that. Yeah, if you go to bed when the light goes out, your pineal gland, essentially kind of located here, senses light. It'll release the melatonin, start your sleep schedule. You get much more efficient REM sleep and deep sleep. So you should be going to sleep when the sun goes down and waking up when it comes up. What age would people assume? So what you're asking is tertiary perspective and cultural context in terms of judgment. So maybe like between 11 and 13, somewhere in there, unless someone has a trauma very early in life, they may be aware of cultural context a little bit earlier, but like 11 to 13. So there's actually an interesting confluence of, understanding your gender identity, your sexual preference, and then this phenomena of cultural kind of oneness or belonging. And a lot of your first blips of suicides come at the age of 11 and 12. Kevin, I have some good news. What I thought I had was Duchenne's muscular dystrophy. It turned to be myotonic muscular dystrophy. I'm still F'd, but not as bad. Thank you for the shows. They really helped. Long live MLC. Duchenne is more severe and kind of accelerated into kind of mortality issues. Certainly, any muscular dystrophy is not great. There's no cure, and it's progressive. But certainly, the one is more severe than the other. Harvard did this great study in 1953 to about 2004, 2005, where they followed thousands and thousands of newborns to figure out how do you make successful adults. And it cost about $5.3 billion. And they did so much research. And the most incredible thing happened. They couldn't find one causative variable, meaning they couldn't figure out, nothing was consistent. How much you made, how smart you were, how attractive you were, where you lived. None of it was statistically significant. So if you're a parent out there, what you should know is you're kind of like breathe a sigh of relief. No one knows how to raise good kids. Some people do, some people don't. You really just don't know. But one side note is we do know that households with high expressive emotion, so yelling at children, have a higher incidence of psychosis and schizophrenia by about 4.5, 4.7 times. Actually, the high expressive communication is just the environment of yelling increases the rates of psychosis by about 4.5. But the rates are so low, they're really low. I'm not saying that if you yell, you're going to make your child schizophrenic. It's just that if there's schizophrenia in your kind of family's history, trying not to yell is a great thing. People can have somatization where you have physical symptoms of your anxiety or anger. But also learning how to be angry at like a 5 out of 10 is much healthier than learning how to be angry at a 10 out of 10. So people with ADHD have a dopamine signaling deficiency in the mesolimbic system, which is our dopamine kind of tracks in our brain. And the mesolimbic system ostensibly is a short-term memory consolidation system before it goes into middle-term and long-term memory in our hippocampus and to some extent our amygdala. So when we're doing task A and we're like writing an email, and we're writing an email to so-and-so to ask about if Liam actually is going to grad school, and then someone knocks on our door and our DoorDash is here and we go walk over the DoorDash. When we get interrupted, usually dopamine signaling patterns hold where we are in that paragraph and what we were doing. And then we go and we get the food, we come back, we sit down, we finish the email. If we have a dopamine kind of, signaling deficiency, when we go to the door and come back, we forget where we were in the email. And we have to start again and start thinking about, is Liam in grad school or is he in college? It's that shift, that task shifting from A to B and back, where it's basically like writing on a whiteboard with a marker that doesn't have any ink. So when you give someone a stimulant that creates more release of dopamine in those synapses of the mesolimbic system, we then have more dopamine signaling and we're able to hold those short-term memories and get back to that task shifting and not have the anxiety and inefficiencies of switching tasks. That's more of a symptom of what happens. So when you treat ADHD, people's anxieties decrease precipitously. So what's interesting is, to some extent, if you don't have ADHD and you give someone a stimulant, it does make them more kind of raise their heart rate, their blood pressure, and so forth. It can cause anxiety. But someone who's got hyperactivity or attention issues because of a dopamine signaling deficiency, they calm down. They kind of have what you'd think is an antithetical or opposite response to the stimulant. In a lot of ways, people say, well, isn't ADHD made up? Isn't it something we're just doing so we can medicate a bunch of people? In general, if you think about it, human beings historically have only done one job at a time. You're the cobbler or you're the fisherman. And people with ADHD, they can hyper focus on one task if they're not being distracted. So actually, having ADHD is more of like an evolutionarily positive trait. It just so happens these days we're all forced to multitask constantly. But to your point, Kevin, I think that if you, from an evolutionary perspective, if you were more calm under stress, you'd be more likely to survive in those stressful situations and pass down your genetic kind of tissue, so to speak. So yeah, it makes sense that you're like that. A lot of people are like that. I have quite a few friends who are trauma surgeons and ER docs that calm down when things get crazy, and that's a personality trait. A head injury doesn't necessarily decrease your ability to internalize and recall auditory kind of auditory signaling, like speech. However, and neither does alcohol use disorder. But when you combine an alcohol use with a head injury, your ability to cognitively process auditory inputs goes down precipitously. Trintellix, it's one of my favorite not SSRIs. It's not an SSRI. It's an antidepressant. It's one of the only ones that's brand only right now. Interestingly, only takes 4 weeks to work, as opposed to most other antidepressants taking 8 to 12. There's no sexual side effects, no weight gain, and actually a 30% cognitive processing increase in the FDA trials. The one big problem with Trintellix is 30% of patients get a nausea that doesn't go away. So I always tell patients, if you don't get a nausea in the first week, this drug's for you, because the other 70% of people respond.
I'ma do my stuff.